Knowledge is protection. And in our series on preparing the community for emergency care, today I will be talking about how to protect the victims of fire injury. What should be the first hand care that can be provided by onlookers or friends or family? I'm Dr. Pranav, HOD Public Health. In our previous episodes, we talked about how to provide first aid care for dog bites, first aid care for snake bite. If you haven't watched as yet, you can look it at our channel. So, if you see that someone is suffering from fire injury, the first thing is try to have a clue after looking at the patient what can be the potential further cause for harm and what can be the history the patient had suffered. Was it an injury done by liquid? Was it an injury by some fire? And what kind of extent of injury you can see? Is it that the skin is still intact, though there is a burning sensation that can happen if you accidentally touch something very hot? This can many times be presented in children who by mistake touched a very hot food utensil or sometimes cooking pot. Sometimes you can see that there is a skin change where there is some fluid inside a skin, and it can be a common presentation when someone has suffered a injury by some hot liquid like some boiling water or milk or oil fell upon you and you suffer that kind of injury. Then if someone has been victim of fire, like accidentally some kids burn themselves when they are celebrating Diwali, so in that cases you will find that upper skin has got burnt. There is a change in skin, the integrity of skin has lost, so the skin is open now. A still further injury is that when you are trapped in a wildfire or sometimes you are trapped in a burning house or things like that. In those cases, you will find that skin is widely open and many times it has just exposed muscles inside or inside of blood supply. So the first two injuries we talked when someone has touched a hot object. So in those cases, you should first allow the patient inside a running water, so the basic burning sensation is controlled. But please take care, there is a myth that you should apply ice or ice cooled water. No, this can prove to be further dangerous. It can further accentuate the damage to the skin. So do not allow ice on the burnt skin. Just put the skin in water so that the damage is less and less. There can be a situation, especially if you are an onlooker, that you find someone's cloth has taken fire, and now the cloth that he is wearing, his shirt or trouser or any cloth, so it is burning and you are victim. I tell you, my friends, from my personal experience, this can be such overpowering scene, and you can see someone is standing there or running and his shirt is on fire. Maybe there was some synthetic material shirt, and I have seen it catches fire like anything. And in that case, your mind feels like you can't really think clearly what to do. So the first thing I want, if you have watched this video and you want to take it as a lesson, just request the patient to lie on ground and roll. Request them to lie on the ground and roll. By rolling, actually the fire can be controlled, and by rolling on ground you try to cut off oxygen supply to the fire, and in between if you could find some blanket, you can apply the blanket on the victim, and then by applying the blanket again you cut the supply of oxygen. And as you remember from your school days, for a fire to sustain it needs oxygen supply. So that's how, any which way, with any strategy, if we cut the supply of oxygen or air from fire, the fire will die down. So the first thing, if you see someone is in a fire where his cloth is burning, so you request them to lie on the ground and roll. By rolling, the fire can be contained, and if we apply further a blanket, it can further be controlled. Post that, apply running water on burnt skin if there is skin is still intact. Then if you have watched our previous videos, you can have silver sulfagine chemical is there, commercially available also in most of the local chemist shop, that is available as a burn solution. So the local chemist will give you this as an emergency lotion for burn. So apply after washing the wound, and you can wash the wound in gentle water, but also ensure you don't put someone's body in water under pressure. Many times in our faucets water come with full force, so that can further damage the skin. So do not allow full force water, let the water stream slowly. Post that, once the wound has been washed, apply this burn solution, the silver solution, then it has covered up. Another thing to take care, do not apply too many kitchen spices. There are a lot of things people will suggest, apply this, apply that, not needed. Once you have applied the basic burn solution, then you rush immediately the patient to the hospital. Many times this half knowledge can be very dangerous, and especially in the cases of, say, dog bite, or in the cases of snake bite, fire, managing the patient at home for long hour can actually do more harm than good. So once you have ensured that there is no longer any fire, once you have ensured that the patient's wound has been washed at least, provide the patient with a blanket to cover so that the fire stops. Post that, apply simple silver saline solution. After that, take the patient to the hospital so that the doctors will evaluate how much skin has been burnt, what kind of damage it has caused, and what preventive measures can be taken, whether there is need for further specialized surgical care or simple dressing is required. And even dressing can be tricky in the condition of fire, because fire dressing many times can get stuck if it is done by immature people who are not well trained in dressing for fire, because you shouldn't really apply cotton on fire wounds. You should apply a bandage that is that can provide a breathing and that doesn't really get to stick. So I would suggest, after washing and after ensuring an application of silver sulfagide so that there is no further infection, you take the patient to the hospital, and that way we provide the best care that is available. If you have any question, any doubt, you can put your question in the link provided below or in the comment box. And I think you stay safe. Keep watching our channel. If you haven't subscribed yet, please subscribe to it. We are going to follow this with a couple of more videos on first aid emergency response as community members. Thank you. Thanks for watching.